So away from our introduction on rheumatologic diseases, I told you guys about rheumatologic diseases. We have an overview and we had an introduction to rheumatologic diseases, right? So away from all that, we'll be talking about types of rheumatologic diseases, all right? So these rheumatologic diseases are actually like a group of diseases that affect the joint and its surrounding tissues, right? So what are the names of these diseases that affect joints and its surrounding tissues? All right, so our focus today is to discuss on the types of rheumatologic diseases, all right? We could see some of them here: osteoarthritis, fibromyalgia, gout, systemic lupus erythematosus, and rheumatoid arthritis. So basically, these are not the only types of rheumatologic diseases. All right, so we have a couple of them here, right? But most of them, from their explanation, it is literally, and you guys will understand. All right. So such diseases that affect the joints, tendons, and muscles are actually called rheumatologic diseases, all right? And examples of these joints include we have arthritis. Now, arthritis is actually joint inflammation with pain and swelling, all right? Or you could say that inflammation of the joint with pain and swelling, all right? Then we have rheumatic fever. Rheumatic fever is basically immune response to an infection, okay? And this will cause what? Inflammation of the heart, joint, brain, and skin. Okay? Then how about fibrositis, also known as fibromyalgia, is basically widespread inflammation causing musculoskeletal pain. Okay? So that's fibrositis. Widespread inflammation causing musculoskeletal pain. Then how about neuralgia? You know that it's new. Okay, so it has to do with the neuron. Neuralgia is basically a sharp, shocking pain, okay, that follows a nerve path due to the irritation of that nerve. Okay, so neuralgia is basically like pains of nerve because maybe these nerves are irritated. Okay, and if a pain, this type of pain will follow where that nerve also followed. Okay, so examples of neuralgia, we have post-herpetic neuralgia. All right, so still an image showing the different types of rheumatologic diseases. Okay, so on the last slide now, we have myositis, and myositis is basically muscle inflammation. Okay, we have myalgia, which is basically muscle pain. Okay, then we have bursitis, which is inflammation of the bursae. All right, so I'm just actually picking out the main point, so that you guys will get the main points. All right, so that maybe when you watch the video the second time, you get the other points that are in the sentence. Then how about gout? Gout is basically deposition of urate in the joints with accompanying inflammation resulting in swelling and pain. All right, so this is gout. And gout is basically like, okay, deposition of urate, sodium urate. Okay, so sodium urate is deposited in the joint, and this will cause inflammation, swelling, and pain. All right. So, guys, with that, these are the different types of rheumatologic diseases. And as we continue on our rheumatologic series, we'll be looking at all of them. All right. So, see you guys.